Well, good afternoon, everyone, and welcome to another PBALC informational live stream. As always, we want to thank our sponsor, Frost Bank, for sponsoring all of our 2024 informational live streams this year. Thank you to Frost Bank. As many of you may or may not know, February is National Health Awareness Month. And so our focus for this informational live stream is health literacy. So today we are excited to welcome Dr. Teresa Wagner with the University of North Texas Health Science Center to discuss health literacy and education, and she can share her wealth of information and information about her organization, um, Health Literacy Texas. So welcome, Dr. Wagner. We're happy to have you today.
Thank you. I'm excited to visit with you.
Absolutely. And as some of you may not know either, February is also American Heart Health Awareness Month. So I'm wearing my red. So if you can, month of February, wear red to raise awareness for your heart. And also because it's, Valentine's month as well, too. So perfect time to wear red. So tell us, Dr. Wagner, a little bit about yourself and about the organization, the Health Literacy Texas organization.
Great. So I'm an associate professor, as you mentioned, at the University of North Texas Health Science Center. I founded Health Literacy Texas in about 2020, not realizing the pandemic was happening at that moment, but like literally on January 1st was when we founded. But in response to the fact that I had at that point testified twice on legislation in Texas around health literacy, and both times they had not passed. But also just knowing that myself and my own education, when I was getting my doctorate, I wanted to specialize in health literacy, and there was no residencies available. There was nowhere to go to learn the skill of health literacy or learn more about it. And so I set out to fix that problem in Texas. And along the way, met a lot of others who were passionate about health literacy as well. And we just joined forces and developed Health Literacy Texas to have an organization that would be ready to serve should that legislation pass, and really also to bring more awareness to health literacy. We have, we're going to start having quarterly webinars. We've been having monthly ones, but we're going to start doing quarterly that are informational and have people who are actually doing health literacy work talk about the work that they're doing.
Perfect. And so why has health literacy become an emerging public policy priority?
Yeah.
Well, why should it become a public policy priority?
Yeah. Given the outcomes of the pandemic, especially the health disparities caused by the World Health Organization coined the infodemic, or vast amount of misinformation and disinformation that was created, health literacy has become an emergent public policy priority. In fact, the deployment of community health workers, if you think about who in communities such as those that were found to be disparate in COVID-19 could do that type of work as a conduit to health literacy in all facets of healthcare and public health, particularly underserved areas exhibiting health disparities. And so it's just literally exploded, and the profession of community health workers has also exploded as a result. I actually am the director of our UNTHSC state certified community health worker training center, where we have, since the pandemic, been actively recruiting people in rural and underserved areas who perhaps are looking either to change careers or to actually have a career, and training them, certifying them to be community health workers for free. To kind of give them that first start to not only help their communities where there may not be any access to healthcare at all, but also to give individuals the opportunity to seek employment.
Mm-hmm. And how would if an organization wanted to partner with a community health worker, how would they find a person like that?
Yeah. So if you know where you can contact the state for one, and they can tell you where there are training centers located in your area. So I have several instructors in rural areas that are affiliated with my center that like in Amarillo and San Angelo, who can also conduct courses for free or can connect people with community health workers they've trained. So
Okay.
it's become a really great network of people across our state that are, of course, that if you think about the traditional definition of a community health worker, people who know their communities and want to serve their communities. It's become a great network of connectors who can connect people and other organizations with the needs that they may have.
And why is health literacy important?
There's a lot of
Why
reasons
shouldn't it
health
be?
literacy is
Yeah, there's a
important.
lot of reasons, but why shouldn't it be, ignored as
Right.
something? Oh, that's not necessary. There's
Yeah.
other
Well,
more important
right.
crises.
We've been trying to convince the legislature of that for several years, almost
Mhm.
10, I think. And the reason, I think primarily, other than, you and I have, and we know people who've gone to
Mhm.
providers and not understood information or been given information that's too complex for us to follow through or really know. And we've seen either catastrophic results or people
Mhm.
who just never get well or don't manage their chronic conditions such as diabetes or high blood pressure well and have other consequences besides just impacting your quality of life. But also, if you look in the literature, it's a patient safety issue because
Mhm.
people that have low health literacy have been linked with poor outcomes, such as reduced ability to understand labels and messages that would help them to follow through on their treatment plan, lower likelihood of even seeking preventative or other types of services such as mammograms or getting their blood pressure checked or having a diabetes screening on occasion, etc. More hospitalizations, because especially if you don't have a good experience with the healthcare system from low health literacy, you're going to be less likely to seek health care. And so you wait until you are so sick that you have to either go to the emergency department or be hospitalized. Worse overall health status in general, and higher mortality among the elderly, and just shorter life expectancy in general. So there's a lot of reasons why we
Yes.
can't ignore health literacy. And one of those is monetary. It's costing the US billions of dollars every year. And individually, it's about 7,500 per person per year. And that, maybe you and I are not paying that, but people with chronic conditions could potentially be paying that much. And people who aren't insured, then our tax
Mhm.
dollars have to pay for that. So it's a huge issue.
And what do you think what factors contribute to poor health literacy or just health literacy in general?
Yeah, there's so many that
Mhm.
it's astronomical, because there's not only individual factors, those that you and I may have as barriers,
Mhm.
but also our healthcare providers. How are they conveying information to us? And so particularly with the new Healthy People 2030 definition of health literacy, where they've separated it out into personal health literacy and organizational health literacy. We know that we have
Mhm.
to look at all of those factors and help our providers to use techniques such as teach back, where they ask, how are you going to make this happen at home? Or can you tell me, can you teach me back what I just taught you? Because I want to make sure I did a good job. So it's all of these things, and health system factors as well, community factors, policy related factors. As I mentioned, we don't have any legislation in Texas, but if you think of other
Mhm.
health policies that potentially impact people in Texas, such as the abortion laws and other things that have been far-reaching without knowing really what the long-term consequences are going to be. So, you have to be, if you think about the socio-ecological model of health, where the person is in the center, and then you have your family, your community, your state, and then, nationally, policies and community-based organizations and healthcare all of these things play a role in whether or not we're able to understand health information.
And do you think, because as a literacy organization, we have a lot of English language learners,
Yes.
English is not their first language. Do you think that has a huge impact on health literacy in general?
Definitely, yes. Because if you are having a difficult time even mastering the language itself, just think about if people are making medical terminology difficult for people who have proficient English,
Yeah.
it's just compounding the issue. When I was in my doctoral residency, I moved to Austin because I had to create my own residency. And I was working at the Literacy Coalition of Central Texas, and interviewing the local federally qualified health centers patients to see what was their experience. And I found that many times that people who didn't speak the language were discriminated against and had, complications from that perspective. And they were like, well, if they're going to be rude to us because we don't speak English, then why do we want to come back? And, many times when you have a health condition, it's very imperative that you go back for a follow-up, right?
Yeah.
So, yeah.
And two, there's also the challenge of many of these, I guess, immigrants and refugees, for lack of a better name, in their home countries, healthcare looks very different than in America, in Texas, and so they don't understand the importance of vaccines. They don't know the importance of of going to your doctor regularly. Like, we didn't have this in our in Burma or wherever their home country was. So there's another challenge on top of that.
Yeah, and yes, and so we do need, I mean, again, the community health workers, promotoras that can be that bridge in terms of between cultures and the healthcare system.
Mhm. Then you have those adults that have very limited literacy. They may speak English, but they still have limited literacy. We have a couple of students that are adult literacy learners, and they have very limited reading and writing skills for various reasons. And so it's very challenging and overwhelming for them to go to the doctor as well, because they have a hard time reading the forms, and the forms can get
Yes.
complicated. So what do you how can people advocate, and also, you know, medical health professionals also help with these challenges?
Right. So one of the things that I often teach people is, to look for warning signs. When you see that people are making excuses, or they bring back forms that aren't filled out. Like one time I was in Austin working with a senior group, and I was, since I was in my residency, I was doing a pre-test and a post-test, because you got to have my research. And this little old man handed it back to me, and he said, "Oh, I don't do that reading stuff anymore. I used to do that a long time ago." And so I was like,
Mm,
"Oh, okay, well, let's all do it together." So I just read
mhm,
it out loud, and we all did it together. So, thinking of strategies like that, where when you see those warning signs, you take action in a non-shaming way,
mhm,
is really important. But also, another thing that we do in the health literacy world is we use what we call health literacy universal precautions.
Okay.
And that's where you just assume that everyone has issues with health literacy. So when you are explaining something, you start at the most basic level. And then as you see that they have more understanding or they ask for more information, then you raise that level up. But that way you make sure that you set that foundation if it's perhaps somebody who doesn't have that good of understanding. And then
Oh,
also
perfect.
making sure that if you give materials to support whatever it is you're teaching, that those materials are written at we use 6th grade level as a standard. However, I know there are communities, especially if there's a language barrier, where it needs to be 3rd grade level. So making sure that that happens. I know it's difficult because, as I mentioned, health literacy is a skill. And so there's not a lot of people who have that skill to be able to help people modify their documents to make sure that they are at a reading level and understanding level for all people.
And can those community partners help with that as well?
Yes, definitely. Because if you if your mission is to serve a certain population, then your target audience. That was something I was going to add is, knowing who your target audience is, because many times those of us who sit in ivory towers don't, know really the culture or don't know the idiosyncrasies of specific populations. And so making sure that if that's your mission to serve that population, then you have those materials available and people that can teach in a manner that people can understand.
Yeah. And how can literacy organizations or libraries or other community-based organizations promote or partner with, like, Health Literacy Texas or other help teach health literacy, promote and teach health literacy?
Yeah, for sure. So I think, one of the things that I think is most important is to make sure that you make it a point. Many times when I would be working with healthcare entities, making it a campaign, a health literacy campaign where it's sustainable, where you're reminding people that this is an important aspect of our work and we need to keep it top of mind all the time. Also, I've worked with a hospital in East Texas who had no bilingual providers, and they had a 60% population that was Hispanic and spoke no English. And they were putting all the COVID-19 information on their website, and they didn't have access to the internet. So, really thinking outside the box to, like, what are the barriers for my community, and getting those community-based organizations involved in solving those problems. So I, again, hired a community health worker out there to do focus with me or with and for me, because she knew the community and was able to bring them together. And that's how we discovered what the barrier was. And so the hospital ended up hiring a bilingual provider, starting a bilingual clinic, and putting information out in Spanish out into the community through mailers and signs in windows of stores and things, so you have to embrace it as a community that, this issue exists. And so how are we going to solve it in all of those socio-ecological ways?
You suggest, though, to healthcare providers specifically to change their ways. They have a certain way of doing things and they don't want to change. And
Yes.
like, maybe the importance of this is going to make a difference in the community. It's going to improve the community, but sometimes that's not enough for them to make changes.
I agree.
Suggestions. I
Yes.
know legislation would be very helpful. Like, there's legislations out there that forces them to do it, but fortunately,
That hasn't happened.
legislation moves very slowly.
Correct.
So what
Yeah,
can
and
we
it
do
is
in the meantime?
difficult. because when I was at the FQHCs in Austin and I reported out, to their leadership about my findings, they were like, yeah, we get it. We understand. However, who's going to pay for my provider to stay in the room for 10 more minutes? And so then I talked about, well, referring to allied healthcare professionals who do have the time to explain those things, and then also thinking more about, rather than the front end, the back end, because if you're saving that $7,500 from readmissions and complications and all of those things, then you're really saving money in the long run. But as far as addressing it with providers and healthcare systems, it is very difficult. And the number one thing that we found in the health literacy world is you have to have administration's buy-in. Until you have that, it is going to be more of a challenge, because administration has to make it a priority and put it in their strategic plan, perhaps their mission, their vision, et cetera, or it's not going to happen. And so I was really lucky in that project in East Texas that administration was the ones that came to me for help.
Oh, good.
Because they had such a high rate of COVID-19. But we're not always going to be in that situation. But we've also, as researchers, done other interventions where we went in and did an assessment. There's a lot of different tools in the health literacy world that you can assess your healthcare system. We piloted in a project I was involved in San Antonio, that same tool with community-based organizations. And so you assess the system to see how health literate it is. And then you pick, like, where are the low-hanging fruit that we can change to become more health literate? And then what are our long-term plans? What are those high-hanging fruit that we need to address in the long term? But again, it takes, leadership buy-in, and it takes dedicated, be willing to make that commitment. And without legislation and other competing priorities, it's very difficult to make that happen.
And I always say, because, worked in the nonprofit sector for a very long time, and we have low budgets, and, we get that, the budget, kickback. It's like, well, then let's find other creative ways to do it. Nonprofit sector has always had to find creative ways to get things done. And so, maybe partnering with a community health partner, or with a literacy organization, or with a community-based organization to make things happen. If
yeah, definitely.
And fitting.
Right. A lot of the work that I've done has been grant funded because, pretty much if you know that health literacy is going to be your specialty, you have to know there's not money for that. And so a lot of my work has been grant funded, or I've been able to leverage, my paid time or my volunteer time to make things happen.
Yeah, that's great. Are there any last thoughts that you would like to add? Any resources or information that you would like our followers?
Yeah, so if organizations are looking for a toolkit that can help them to develop some health literacy strategies, myself and another researcher at Texas Christian University developed a toolkit. It's called Innovate to Communicate, and that is available on healthliteracytx.org, our organizational website, under toolkit. There's also a training from the Institute for Healthcare Advancement, who, as I mentioned when we were chatting before this, they actually have a free conference that's virtual that will be in May. So if you want to learn more about different aspects and just basic health literacy information, you can attend that conference. I believe their website is IHA.org, but I'm not 100% sure on that. But we have a discount. They also offer a certificate program where you can go in and study different aspects of health literacy if you just want to increase your own professional knowledge of health literacy. There's a discount code on our website. Many times organizations might pay that fee for you if, or you have dollars for continuing education. Or you can write a grant and cover that for yourself and partner with an academic institution or a community-based organization. But if anyone attending today is interested in becoming a community health worker, as I mentioned, we provide that certification training for free. And they can go to our website, which is UNTHSC, so University of North Texas Health Science Center, .edu. And then go to the School of Public Health Community Health Worker page, and you'll see my picture. But you can contact us and get signed up to become either a community health worker or a community health worker instructor.
Oh, that would be fabulous. Any resources that Dr. Wagner shared today, we'll share on the comments page, as we always do with our live streams. So if you didn't catch any of of the sites, don't worry, they'll be in the comments. Well, thank you, Dr. Wagner. This has been great. Thank you for joining us and providing us a wealth of information about health literacy. It's such an important topic that PBALC is offering a six class health literacy workshop. And first class starts February 26th. So if any students are interested in the class, they can call us 432-682-9693. We'll put that in the comments as well. Space is limited though. So if you're interested, make sure and call us and we'll get you signed up for that. Otherwise, I hope everyone has a fantastic February, and make sure to wear your red for Heart Health and Health Awareness Month. And we will see everyone next month for our next live stream. Thank you, everyone.